Hello, everybody. Hello, hello. Can everybody hear me? Let me know in the chat, and we will go ahead and get started. Hope everyone's having a great Monday so far. Great start to their week. Let me know if you can hear me. Let me know if you can see my screen. Okay, awesome. Thank you so much. I appreciate it. Okay, so welcome everybody, new or returning, as always, to our ICD-10 CM Guideline Mastery session. I am Ms. Haley. I'm going to be your lead instructor for this class. And I'm so excited to have everybody here joining us. I am also accompanied by my wonderful team. I'm sure you've already seen them, encouraging everyone in the chat, also providing that survey link already, just being on top of everything. Ms. Vina and Ms. Olga, they are going to be there the whole time during our class. So if you guys need anything, definitely don't hesitate to put it in the chat. And we are going to be beginning our week 4. So we are halfway through our session, which is so crazy. Time is just flying by. So since we are in week 4, we are going to be going over and reviewing some endocrine, some mental health, nervous, and eye disorder guidelines. So as always, I'm going to be using our ICD-10 CM guideline book, also referencing our MCG manual. So definitely make sure to have those both handy if you can. And then we will be going through our interactive Jeopardy game, and that will get us more familiarized with these guidelines. It is going to be chapters 4, 5, 6, and 7 specifically, so definitely make sure to have your books turned to those pages. And then we're going to move into some more in-depth scenarios so we can fully master these guidelines. So without further ado, let's get into it. You already know I'm going to quickly read this little copyright really quick. Okay. ICD-10 CM Copyright 2026, American Medical Association, all rights reserved. Fee schedules, relative value units, conversion factors, and/or related components are not assigned by the AMA, are not part of CPT, and AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispose medical services. The AMA assumes no liability for data contained or not contained. ICD-10-CM is a registered trademark of AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept FTR, Chun, AMCI Fab 7, AMCI ICD-10, Flip, TAP, and MCG are trademarks of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI does not own the rights to these credentials. So the credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHEMA. AMCI does not own the rights to these credentials. Whew. All right. So without further ado, we will go ahead and get started. I see that someone asked, so we're going to warm up with our Jeopardy. So I'm going to stop sharing my screen really quick and grab our Jeopardy game. But while I'm doing that, somebody asked in the chat, if we can, where we can find the replays. So we're on YouTube right now. So the same way you found this video, you're going to go on YouTube, you're going to go in the live section, and then under the live section has all of our previous live videos that we held. They're all going to be recorded. So you can go back and just find the one that you're looking for. They should all be, again, under the live section on our YouTube page. So super easy to find, and then you can, take your time looking through them and practice as much as you want. Okay. So I'm just going to wait for my screen to load. Okay. So for today, we have our different categories. Like I said, we're going to be doing these different chapters. So we're going to start off the first section with chapter 4, which is going to be our endocrine, nutritional, and metabolic diseases. This is specifically going to be the codes E0 through E89. Then we're going to have our chapter 5. Then we have chapter 6, diseases of the nervous system. So G00 through G99. Chapter 7, diseases of the eye and adnexia. H00 through H59. And then without further ado, so we have those 4, 5, 6, and 7, and we are going to start off with 100 to get us all nice and warmed up from our chapter 4. And so, as always, these are all going to be true or false, so make sure to put those answers in the chat. So, our first question of the day, true or false, always code based on provider documentation, not assumptions based on age. Is this going to be a true or false statement? Let me know in the chat, and then we will go over it in a few. All right. 30 seconds is up. So this one is indeed going to be true. This is It's going to be true for pretty much any coding scenario. You definitely do not want to make any assumptions when you are doing any kind of coding. You always want to go based on the provider documentation. So that was a great start. Keep it up, keep it up. Now we are going to move to our chapter 5, our mental and behavioral and neurodevelopmental for 200. Again, true or false. So, when use, abuse, and dependence of the same substance are documented, assign only the code for the highest level, and the highest level is going to be abuse. Is this going to be a true or false statement? And again, if we are curious about what specific guideline I used or what specific guideline I took this from, we always go over it at the very end. So if you need a little bit more in depth into where I found these guidelines, definitely do not fret because I will reference them all at the end. But for now, I'll give you guys a few seconds on this one. Let me know in the chat. Okay, so this one is going to be trying to be a little tricky. So everything is true about this except for one thing. So in the MCG manual or in the ICD-10 book, it does say when use, abuse, and dependence of the same substance are documented. It is true you should assign only the code for the highest level, but in this case, the highest level is dependence. The highest level is not abuse. So that is what makes this statement false. Again, I just switched out one little word. So if you didn't get that one, no big deal. That's why we are here. Practice makes perfect. But yes, when it comes to use, abuse, and dependence, the highest level of those is going to be dependence. So great job if you caught that one. Hopefully we learned something. We're going to move right along to chapter 6, diseases of the nervous system for 300. Again, true or false. So routine or expected routine or expected post-operative pain immediately after surgery should be coded. True or false? Alrighty. I am loving all of this participation in the chat. Keep it up, keep it up. So I'm getting a little bit of mixed responses for this one. So this one is going to be another. I'm not doing it on purpose. Okay, so the reason this one is false, routine or expected post-operative pain immediately after surgery should not be coded because this is kind of, you just got out of an operation of some sort. It is expected to have a little bit or some sort of pain afterwards. So that's why it specifically says routine or expected post-operative pain shouldn't be coded. Obviously, if this changes, until a little bit afterwards or an infection or something, that should be coded. But again, I will reference the exact guideline where I found this. But if you caught that, then amazing job. And again, we will go over the exact one afterwards. And now we're going to move on to chapter 7, diseases of the eye and annexia. We're going to go for a 100. This is going to be a long one. Okay. So when a patient has bilateral glaucoma and both eyes are documented as having the same type and stage of glaucoma, and there is a code available for bilateral glaucoma, assign the bilateral code for that type of glaucoma with the 7th character indicating the stage. So I know that this is kind of a long one, so I'll give you guys a little bit of time to look over it. Let me know what we think in the chat. Alrighty. So this one is going to be true. Amazing job. So yes. So if the patient does have that bilateral glaucoma and both eyes are same type and stage, and you go into the ICD-10 book and you look at the codes, a lot of them are going to ask for a 7th character. So definitely if there is a code available for bilateral glaucoma, you should definitely use that. Definitely use that 7th character. So that makes this one true. Great job. Again, great participation. All right. I love people just giving it a shot in the chat too. That's why we are here. Okay, let's move back over to chapter 4, our endocrine nutritional diseases for 200. Okay. When the type of diabetes mellitus is not documented, the default is E10 or type 1 diabetes mellitus. Is this true or false? Let me know in the chat. Okay, I am getting an overwhelming response of false, and that is going to be correct. This is going to be false. So it's false because you are going to default to E11 or type 2 diabetes mellitus when the type is not documented. So it's not going to be type 1, it is going to be type 2, which makes this statement false. So if you caught that one, which everyone did, great work. Yes, awesome job indeed. Okay, let's move back to our chapter 5. Let's do a 300. Okay, true or false? Use psychoactive substance use disorder codes only when the provider documents the substance use and its association with a physical, mental, or behavioral disorder. Know this one has a lot of words, so I'll give you guys a little bit of time and put those answers in the chat. Okay, time is up. So this one is going to be true. So, yes, so these are the requirements in order to use that psychoactive substance use disorder code. So, if you got that one right, amazing. I know this one was a little 50-50 as well. So, hopefully we are learning some of these guidelines. I know it's 4 different chapters, so it's a lot. And again, you never have to memorize all these, guidelines word for word. So, if we didn't get that one, no big deal. That is why we're here to learn. All right, let's move back over to chapter 6, diseases of the nervous system. Okay. Default to dominant for the left side and non dominant for the right side when we're talking about the nervous system. Is this true or false? What do we think, coders? Let us know. All right, I'm getting a lot of awesome responses. So this one is going to be false. So, um, I don't even know what I'm trying to say. I just blanked out for a second. So, this statement is going to be flip-flopped. So you are going to default always dominant for the right side and non-dominant for the left side. So this is just the complete flip-flop. And so that's what makes this one false. As always, if you caught that one, great job. And if we learned something, even better. Okay, let's do a 200 from our chapter 7, diseases of the eye and adnexia. Okay. True or false? Assign as many codes from category H40, which is the glaucoma code, as needed to identify the type of glaucoma, the affected eye, and the glaucoma stage. True or false? All right, all right. So this is going to be true. So yes, you can use as many codes from this category always. If there is a combination code, definitely use that, but there definitely is no limit on how many codes from this glaucoma category that you can use. So yes, on fire. Great job, guys. So, yes, this one is true. And again, I will go over what exact guideline says this. So, if we need to use this video as a tool, then we can go back and do some more research on these guidelines. So, let's close out our chapter 4 with a 300. Okay, diabetes mellitus codes are combination codes that capture three key elements: the type of diabetes mellitus, the body system affected, and any complications affecting that body system. So, what do these diabetes mellitus codes cover? Is this going to be true or false? All right, time is up. Yes, this one is going to be true indeed. I wasn't trying to be tricky or anything. This is what diabetes mellitus codes cover. They're going to cover, the type of diabetes, the body system affected, and complications affecting that body system. So I think everyone got that one right. Outstanding job. Way to close out that category. Okay, now let's close out our chapter 5, our mental, behavioral, and neurodevelopmental for 100. Okay, as always, true or false, moderate or severe substance use disorders in remission. So, if you see a moderate or severe substance use disorder in remission, code as substance abuse in remission. So, how are we coding moderate or severe substance use? True or false? Let me know in the chat. Okay, so this one was a little bit of a tricky one. So this one is going to be false. So the reason that it is false, this guideline is a kind of a two-parter. So there's different ways to code mild substance use disorder in remission and then moderate or severe substance use disorder in remission. So when it comes to mild substance use order in remission, you're going to code as substance abuse in remission. And then if it's moderate or severe substance use disorder in remission, you're going to code as substance All right. Can you guys hear me again? I'm so sorry about that. Perfect. Okay. Hello. Can you guys? Okay, perfect. I'm so sorry. These storms over here are crazy, and my internet decided it wanted to shut off. I'm so sorry about that. Okay. Thank you so much for your patience. Thank you so much, Ms. Vina and Miss Olga, for holding it down for that minute or two. My goodness. I love when internet shuts off. Okay. So let's just dive right back into it. So let's do our 200. Okay. Yes, thank you so much. Okay, so let's go back into our true or false. So pain codes from category G89 are not assigned if the focus is on addressing the condition rather than managing pain. All right, let me know in the chat and then we will go over in a few seconds. Okay, so this one is going to This one's going to be true. So category G89 or codes specifically from this chapter are all about pain management. So whenever you see something from category G89, that's what it is going to be, pain management. So if something is just focusing on addressing the condition, then we're not going to be using this category. So that is what makes this one true. So great job if you got that one. Okay, and now we are going to do our last question from chapter 7, diseases of the eye and adnexia. Let's end on a great note and then we'll move into our in-depth scenarios. Okay, so for indeterminate stage glaucoma, assign the seventh character 2 when clinical documentation indicates that the glaucoma stage cannot be clinically determined. So this is going to be a seventh character question. This is a little niche, but let me know what our thoughts are, true or false. All right, all right. So this one is going to be false. About this, everything about this statement is true except for the seventh character. So for indeterminate stage glaucoma, you're going to assign the seventh character 4 when clinical documentation indicates the glaucoma stage cannot be clinically determined. So that's why I said it was kind of niche. So you'd have to have definitely have your ICD-10 book handy. But yes, the seventh character is the only thing that is going to make this statement false. So, and that's why it was a 300 question. So if you got that one, great job. But if not, no big deal. Again, I just changed one little number. So was trying to be a little sneaky, but that is why we're here. As always, practice makes perfect. That was great participation to end that game. I am going to stop sharing my screen for just a second. It's not going blank, I promise. Okay, so I'm going to switch right back over to our PowerPoint. So again, I was talking about all of our guideline references. So I'll share my screen just so we can see all of the guidelines that I used. I'll click through them kind of quickly because again, this is going to be a recorded video. So if you need more time looking at these specific codes, then I would suggest looking at the recording so you can pause this presentation for as long as you need to. So this is going to be all of the questions, all of the answers, and all of the guideline references from the Chapter 4, Endocrine, Nutritional, and Metabolic Diseases. All right. This is going to be from Chapter 5, Mental, Behavioral, and Neurodevelopmental. Again, question, answer, guideline. This is going to be from our Chapter 6, Diseases of the Nervous System. And then last but not least, this is going to be all of the questions, answers, and guideline references from our Chapter 7, Diseases of the Eye and Adnexia. All right, so I hope that we're feeling good. I hope we're feeling confident. Hopefully we've been learning some stuff. So I am going to switch over. Now we are going to start our second portion of our guideline mastery session. If you are new, this is going to be in the form of Quizlet. So we're going to go over 3 different scenarios, and we're going to break each scenario down into keywords. Then we're going to break it down into the guideline we're going to use to solve. And then last but not least, we are going to find our final ICD-10 codes. So we will start off with our first scenario. I will read it and type out the keywords you think should be reported. So let me make sure. Okay. So a patient with secondary diabetes mellitus following a partial pancreatomy is seen for management of diabetes. The provider documents that the patient requires long-term insulin therapy and a daily oral hypoglycemic medication to maintain glycemic control. No diabetic complications are documented. So what keywords are we reporting? What keywords do you think we should be focused on in order to find our guideline and in order to find our ICD-10 codes? Put it in the chat. I'll give you guys a little bit to type it out and then we will go over it. All right, I'm getting a lot of amazing responses in the chat. So yes, so everyone is on the right track indeed. So yes, so what I put that we should be focusing on, that secondary diabetes mellitus, and also that they are being seen for management of diabetes. Also the long-term insulin, the daily hypoglycemic medication, and no diabetic complications. So if you put any of those in the chat, outstanding job. Now we are going to focus on the second part of our scenario. So the same scenario. We're going to keep those keywords in mind, and now we are going to choose a guideline that we are going to use to code this scenario. So to kind of narrow it down, it is going to be a guideline from our chapter 4, that endocrine system. So you can either put the name or the title number if you want to do that. But yes, within the chapter 4, to kind of narrow it down, what guideline from there are we going to choose to solve this scenario? Let me know in the chat. I'll give you guys about a minute and a half. All right, it is about that time. So, yes. So, the guideline that we are going to be using for this is going to be IC4 6A, and the title of that is going to be Secondary Diabetes Mellitus and the Use of Insulin and Oral Hypoglycemic. So, great job if you got that one, or if you're on the right track, or you took a shot at it. So, great work. I see some other really good guideline suggestions as well. You guys are rocking, I agree. Okay, so now we are to our final part of our in-depth scenario. So we're going to use those keywords. We're going to use that guideline we were just talking about. And now we are going to find the specific ICD-10-CM code or codes that we should be reporting for this scenario. Again, I'll give you guys another about a minute and a half, and then I'll switch over to the PowerPoint so we can see how everything looks all together. Alrighty, it has been about 2 minutes now, so I am not going to give away the answer just yet for those of you who are still working on it. So if you're still doing that, I'm just going to stop sharing my screen and switch over to our PowerPoint so we can see how everything looks all together and how we are going to find those codes. Alrighty. Okay. So here is the scenario that I was referring to the whole time. I won't read the whole thing, but the keywords, like I said, that we are going to take out are going to be that secondary diabetes, also the patient being seen for management of diabetes, also the long-term insulin, the daily hypoglycemic medication, and also no diabetic complications. So this is going to be the guideline that we're going to be using. This is just a clip from the MCG manual. So this is going to be our IC4A6A, the one that we were talking about, secondary diabetes mellitus and use of insulin and oral hypoglycemics. This one is pretty cut and dry for what guideline you should be using because all of these in the title, these are all keywords that we took out of right here. So if you look at the right hand little column right here, you will see our sequencing suggestions. So our first is going to be our diabetes code. So again, if you look, we are coding for secondary diabetes. So with that being said, we're going to go into our ICD-10 manual and we're going to get our first code, which is going to be E08.9, which is going to be diabetes mellitus due to underlying condition without complications. The reason that it says without complications, again, in this scenario, a keyword we took out are no diabetic complications. So that's why we were going to use this code without complications. Also, due to an underlying condition, so that is why we are using this one. And then if we look in our second sequencing suggestion, we just have a code, which is going to be our Z79.4, and that is going to be the code for long-term or current use of insulin. So that is why we are using that as our second code. Again, because our keyword that we took out right here, long-term insulin, and then we have our code for long-term insulin. So that is awesome. And then our third code is going to be our code for those hypoglycemic medications. So again, you're going to go back into your ICD-10 CM book and you're going to find the third and final code, which is going to be code Z79.84, which is long-term or current use of oral hypoglycemic drugs. So that is going to, all three of these codes are going to, those are the three that we're going to be using for these. And again, it all makes sense with all of the sequencing suggestions and the guideline that we used. So hopefully that made sense. Hopefully let me know if the explanation made sense or if we have any other questions about this scenario. But yes, so this is why it's so important to take out those keywords, because using all of those helped us find this guideline and helped us find these codes. So that was a great breakdown of that. That was a great effort. If you guys put some codes in there or if you took a shot, amazing job. Again, let me know if the explanation made sense, but I am going to go ahead and move into our second scenario. And if you have any questions that you want to ask that you don't want to put in the chat, again, you can always use our survey link and you can ask a question in there and I will be happy to go into more detail. The code from E13, which guideline, which, I don't know. It just says it says our first code should be just the diabetes code. I don't know if it's a different guideline. Let me know. Let me know in the chat. But yes, I will stop sharing my screen. Thank you, Miss Olga, for putting that survey link again in the chat. And I will go back to our Quizlet. And then we will go over our second scenario and we are going to start from the top and we are going to pick out our keywords from this scenario. Okay, so a 52-year-old man presents to the emergency department complaining of burning epigastric pain, nausea, and several episodes of vomiting over the past 2 days. He reports consuming large amounts of alcohol daily for many years. After evaluation, the physician documents alcoholic gastritis without bleeding. The provider also notes that the patient meets the criteria for alcohol dependence and recommends referral to a treatment program. No gastrointestinal bleeding is identified during the encounter. So I know this one is a long one, so let's shorten it by picking out those key words. What keywords should we report for this scenario? Let me know in the chat. All right. Time is up. Okay. Miss Becky, I am looking at your guideline. I'm not ignoring you. I'm trying to look at while we're doing this. So I'm looking at that guideline. I'm not ignoring you. These are going to be the keywords we are taking out of here. So those signs and symptoms that they had with all the vomiting and all of that and nausea, vomiting, also the alcoholic gastritis without bleeding. Without bleeding is a big one. And then also the alcoholic dependence would be another big keyword. So everyone seemed to be on the right track. So great job. I'm going to switch now over to our second part of this. So we are going to be picking out our guideline, and the guideline that we are picking out is going to be in that chapter 5 specifically. So to kind of narrow it down a little bit, that's where we're going to find that guideline, because that's going to be from all of the neurological mental disorders. So let me know what we think that is in the chat. I'll give you guys a little bit of time to think about it and let me know. All right. So, someone put that the font is too small, so you might be on the mobile video. So there are two different live videos. One is specifically for people using a mobile device, and so that's why the font is so small. So if you're on a laptop or a computer and you're using the mobile device video, then the font is going to be super small. So I would suggest going back to the live section. The two videos are right next to each other. It's the same live video streaming, but one is specifically geared for laptop users and one specifically geared towards people on their mobile phone. So if your font is too small, that's probably the reason why. So just unclick and then join back into the different video. And to continue our scenario, this is going to be the guideline we are going to be using. So IC5B4, mental health and behavioral disorders due to psychoactive substance use, medical conditions due to psychoactive substance use, abuse, and dependence. So you guys nailed that one. And I have no doubt that you'll nail the next part of this scenario. So again, using those keywords, using that guideline, what ICD-10-CM codes are we going to be reporting for this scenario, code or codes? Let me know in the chat. Again, I will give you guys about a minute and a half. Let me know. All right, it has been about 2 minutes, so I'm going to switch over to our PowerPoint so we can see how everything looks all together. All right, let me go ahead and grab that. Okay, that was our last scenario. Here's going to be our next scenario. Again, I won't read the whole thing, but we are taking out those signs and symptoms. So the epigastric pain, nausea, vomiting, the alcohol gastritis without bleeding, and the alcohol dependence as well. This is going to be the guideline that we are going to be using to solve this scenario. So specifically substance use, abuse, and dependence. And so first, if you again look at the right hand column right here, our sequencing suggestion, our first is going to be the medical condition. So then we would go right back to our keywords and we would see that the medical condition right here is going to be the alcoholic gastritis without bleeding. So if we see that, we're going to go into our ICD-10-CM book and we are going to see our first code. So that is going to be from the category 29.2, and then you see that it needs 5 characters, so then you go down and you find K29.20, alcoholic gastritis without bleeding, because again, that is another keyword we took out, was without bleeding. So that is how we are going to find our first code. And then if you go back into our sequencing suggestions right here, our second code is going to be a code from the category F10. So then you would go back into your book, look into that category and find the code that best describes the scenario. Again, looking at the code words or the keywords, we see alcohol dependence. So that is going to lead us to our second and final code, which is going to be code F10.20, which is going to be alcohol dependence uncomplicated. And we see that it's uncomplicated because we see without the bleeding, and we also see no gastrointestinal bleeding is identified. So that's why we are picking the code for uncomplicated. So these are going to be the two codes that are going to be used to solve. It also says right here, if you need another suggestion, if you look under here from the alcohol gastritis, it says use additional code to identify alcohol abuse and dependence. And it also gives the same coding category from this sequencing suggestion too. So there's two little nudges that they give you in order to find the second code as well. So hopefully that makes sense. Hopefully the explanation made sense, but I think a lot of people got that one right. So absolutely outstanding job. Or if you gave it a shot, a lot of people were on the right track. So great work. And now we are going to find our final in-depth scenario of the night. So I will switch back over to our Quizlet, and then we are going to start from the beginning one last time, and we're going to pick out the keywords for the scenario. And the scenario is going to be a 68-year-old woman presents to her ophthalmologist for a follow-up examination of her glaucoma. After a comprehensive eye exam and review of visual field testing, the provider documents primary angle closure glaucoma, chronic, bilateral, moderate stage. The patient is instructed to continue her prescribed eye drops and return in 3 months for monitoring. So what keywords are we taking out of this scenario so that we can find our guidelines, so that we can find our final codes? Let me know in the chat, and then we will go over it. Good luck. Okay. So, the keywords that we're taking out of here, and again, everyone was on the right track. So, great job. Everyone's really good at taking keywords out of here. So, I'm taking out the primary angle closure glaucoma, it being chronic, bilateral, and moderate stage. Those are all super important keywords to take out. So, if you put those in the chat, amazing job. Now you already know what we're doing next. We are taking out our ICD-10 CM guidelines. This is going to be from our Chapter 7 guidelines. Again, just to kind of narrow it down because I know that we're going over 4 chapters of guidelines today. So I'll give you guys a little bit of time to let me know what guideline we're thinking of, and then we'll move on to our final codes. All right. Amazing job. Okay, so the guideline we're going to be using from here is going to be guideline IC7A2A, which is going to be glaucoma, bilateral glaucoma with same type and stage. So great job. And then I'm going to switch over to our final part of the scenario, which is going to be to select our ICD-10 CM code or codes. I won't give you guys as much time because I see some people are already killing it in the chat with those final codes. So let me know what we think, and then I'll switch over one last time to our PowerPoint and we will go over it. All right, as always, if you are still working on this, definitely continue. I'm just going to switch over to our PowerPoint so we can see how everything looks all together. Okay. You guys have been doing amazing with this one. I'm seeing so many answers in the chat, so great job. So our scenario and then our keywords, that primary angle closure glaucoma, it being chronic, bilateral, and moderate stage. This is going to be the guideline that we are going to be using for the final codes. So it says to use a 7th character for the stage when both eyes have the same type and stage. And this is going to be exactly what we're going to be dealing with based on our keywords. So then we are going to go into the ICD-10-CM manual. We are going to see that we are presented with our first code, which is going to be H40.22, our chronic angle closure glaucoma. And then we see if we go above it that it is going to require a 7th character because we are going right down here. Since it is bilateral, we see that H40.223 is going to be what we're going to be working with. And then it does require a 7th character as prompted by our little box right here. So then we look at the 7th character options, and then we see, again, based on our keywords, that it is going to be a moderate stage. And so that is going to lead us to our one and only code we are going to be using for our scenario, which is going to be the chronic angle closure glaucoma, bilateral, moderate stage, H40.2232. And I think everyone that gave it a shot in the chat got it correct. So that was an amazing way to end this class. Amazing job. And all right. So if you guys had any more questions about today's scenario, Becky, I believe that you are correct with that scenario. I am going to do some research, and next week we can go over it. Or if you want to click on the link for the survey and just message me so I can message you back and we can kind of go over it together. But I'm going to research that and make sure that we're using the right guidelines. So thank you for bringing that to my attention. If anybody had any other questions about this specific class, anything we went over, or if you want to leave feedback, definitely don't hesitate to click that link that Miss Olga so graciously put in the chat once again. Let us know how we're doing. Thank you guys so much for your participation and just the awesome responses in the chat. We really appreciate it being such an interactive class. It definitely makes things more exciting and everyone's, so happy to learn. So thank you guys so much for joining us. Thank you so much to my awesome, wonderful team, Miss Olga and Vina, as always, being so great in the chat and super encouraging. So thank you so much. Yes, again, click on the link if you have any other questions, but we will see you next week, same time, same place, and we will be going over our week 5 guidelines. So hope to see you guys next week, and everyone have a wonderful rest of your night.
4,000 exam passers and free classes at AMCI. Learn to coach straight from home or on the road at